Jai Hind. I am Cadet Ananya Anand, representing Karnataka Goa Directorate, 6 Karnataka Air Squadron NCC, Mangaluru, NCC Air Wing, Flight A. In this lecture, I will be explaining the topic Aviation Medicine. Here begins the presentation on Aviation Medicine. Aviation medicine, as the very name suggests, is a field of medicine dedicated and tailored for pilots, aircrew, etc. There are many factors present in the aviation environment that are quite harmful to humans. As listed here, they are reduced atmospheric pressure, reduced available oxygen, noise and vibration, and subfreezing temperatures. Going ahead, let us look at each of these factors and how they harm the pilot or aircrew separately. Let me now explain the ailments caused during changes in atmospheric pressure. Because of the change in barometric pressure during ascent and descent, gases trapped in certain body cavities expand or contract, according to the Boyle's law. The inability to pass these gases may cause abdominal pain, toothache, pain in ears or sinus cavities. In some cases, the pain may be so severe as to lead to incapacitation. The condition caused by changing barometric pressures are known as dysbarosyms. As mentioned here, ear block is one of the barotraumas caused by change in barometric pressure. A barotrauma is a physical damage that happens because of change in barometric pressure. Now, as you can see from this diagram, the ear, a part of the ear called the middle ear, contains air which needs to be replenished through the eustachian tube. If this does not happen, the eardrum could rupture and result in pain and even temporary deafness. The replenishment of air, happens easily during ascent, but the problem happens during descent because the eustachian tube, does not open easily. This is aggravated if the individual has a cold, an allergy, or an infected throat. Thus, the pilot and passengers must consciously make an effort to swallow or yawn to simulate the muscular action of these tubes. If that does not work, then the Valsalva technique is commonly used. That is, to close the mouth, hold the nose, and blow gently. Next, let me explain all the problems caused by a lack of oxygen as one moves higher and higher into the atmosphere. It is common knowledge that the amount of oxygen or the concentration of oxygen decreases as we ascend. And this creates serious problems to our body since oxygen is what we primarily function on. And one of the most common problems caused because of this is known as hypoxia. Hypoxia comes on without warning of any kind, and this is why supplementary oxygen must be available in any aircraft that will be flown above 10,000 feet. The general rule of oxygen above 10,000 ASL by day and above 5,000 ASL by night is on the wise pilot will practice to avoid hazard of these deliberating conditions. Hypoxia can be defined as a lack of sufficient oxygen in the body cells or tissues. There is progressively less air and therefore less oxygen as we ascend to higher altitudes, and thus this situation happens. The most important fact to remember about hypoxia is that the individual is quite unaware that he is exhibiting symptoms. The brain center that would warn him of deficiency of oxygen and of his decreasing efficiency is the first to be affected, and thus the pilot enjoys a misguided sense of well-being or euphoria. There is no pain nor any other warning signs that tell the pilot that his alertness is deteriorating. Thus, the effects of hypoxia can then progress to reduced vision, confusion, inability to concentrate, impaired judgment, and slow reflexes to eventual loss of consciousness. Because of this, it should be identified at an early stage. The first symptom occurs as diminished night vision when the pilot is above 5,000 feet. Then, when one goes above 14,000 feet, cyanosis is seen. Cyanosis is the blue discoloring of fingernails, and it is first noticed at this stage. As the pilot ascends to 16,000 to 18,000 feet, more symptoms come in, such as disorientation and losing control of the aircrafts without knowing. Eventually, this leads to unconsciousness and even death. Thus, taking in oxygen is the only way to prevent the onset of hypoxia and should be taken very seriously. Low temperature is also one of the primary stressors in the aviation environment. Temperature is known to drop in a very predictable fashion known as the lapse rate, which represents a 3.5 Fahrenheit drop for each 1,000 feet ascent. Lapse rate is shown in the graph towards the right. Other than the previously mentioned ailments, there are two other primary conditions that are prevalent in the aviation environment. They are hyperventilation and fatigue. Let us move on and learn about these two conditions. As mentioned here, hyperventilation is not caused by external factors such as atmospheric pressure, temperature, etc., but rather by emotional factors. Hyperventilation, or it's also called overbreathing, is an increase in respiration that upsets the natural balance of oxygen and carbon dioxide in our body. And as I said before, this is a result of emotional tension or anxiety. Under conditions of such stress, fright, or pain, a person may unconsciously increase his rate of breathing. Thus, he expels more carbon dioxide than his body produces, and this results in a deficiency of carbon dioxide in the blood. The most common symptoms of hyperventilation are dizziness, tingling of toes and fingers, hot and cold sensations, nausea, and sleepiness. Unconsciousness may also result if hyperventilation is prolonged or if the breathing rate is not regulated before that. The remedy of hyperventilation is obviously a conscious effort to slow down the rate of breathing and to hold the breath intentionally to allow carbon dioxide to build up inside the body. Sometimes, if this is difficult, breathing into a paper bag would also definitely help. The early symptoms of hyperventilation and hypoxia, which was mentioned earlier, are quite similar and are easy to be confused with each other. One way to check is to see if the breathing problems still prolong after we take in 3 or 4 deep breaths of oxygen from the oxygen tank above 18,000 feet. If it prolongs, it is hyperventilation and should be treated as such. Fatigue is one of the most common psychological problems for aircrew members, and it will adversely affect individuals who are otherwise in good health. It has repeatedly been cited as a casual factor in airplane accident. Fatigue degrades performances and makes the pilot tired. The pilot cannot carry out tasks as reliably and accurately as he should. He is irritable and less alert, willing to accept lower standards of accuracy and performance. Fatigue begins when the pilot begins a flight and it increases with each hour in the air. Because of this, at the time of landing, when the pilot should be more keen, the judgment is less clear and the pilot is affected by the effects of fatigue. The biggest danger of fatigue is that the individual may not recognize its effects even though the symptoms are present. Speaking of symptoms, they are deterioration in timing of movements, irritability, lack of patience, a tendency to lock the attention on individual instruments rather than looking at it as a whole panel, a tendency to become forgetful and ignorant, a tendency to over-control the airplane, and a loss of sail-off-plan's flying ability, a tendency to accept wider margin of error, and so much more. So what causes this? Fatigue is caused by quite many factors, such as lack of sleep, poor nutrition, prolonged and repeated flights, aircraft noise, eye strain, vibration, temperature, humidity, heavy workload, frustration from work and family, monotony, boredom, night flights, etc. Fatigue is of two types, acute and chronic. And as we can guess, acute fatigue is easily treated. A meal and a good sleep is enough. But chronic fatigue is more serious, and it is caused by stressful work or other difficulties in life, and that reflects as fatigue. And this gets often aggravated, so it needs better medical care. A sound physical condition, a healthy mental attitude, proper diet and adequate rest are pilots' best weapons in fighting fatigue. On very long heights where the pilot and co-pilot share the piloting duties, a 15 to 20 minutes pre-planned power nap would also be very useful. And caffeine in adequate quantities, that is in moderation, is also helpful. Blood sugar level should also be maintained and everything will go fine. All these precautions when taken would definitely keep fatigue at bay. In conclusion, aviators need to be aware of the aeromedical aspects of aviation, the importance of oxygen content in the body, hypoxia, hyperventilation, flying fatigue, etc. The most competent, knowledgeable and experienced pilot continues to fly as long as he or she is medically fit. Therefore, maintaining physical fitness is of utmost importance. Thus, we have reached the end of this lecture. Thank you so much.